Hey guys, it's Kelly again with Project Full Motion, and I just wanted to quickly go over cupping of the forearm for your pronator teres. There are two muscles that pronate the forearm, but the pronator teres is the prime mover, and its action is to take your hand from palm to the sky and it turns it over. So I talked about this in a previous video, but really briefly. So yes, palm to the ceiling and then takes it to the floor. And so then that muscle is located right here. So if you find your bony landmark on the outside of your elbow and then come down about 1-2 finger widths and then go in towards your center of your forearm and then push in just a little bit, you're probably going to feel a little discomfort. That means you're on your pronator teres. Your pronator teres is probably going to be angry. We are all constantly pronating our arms with our excessive amount of cell phone use, computer use. When you're exercising and you're flexing your forearms, your pronator teres is constantly being squished and contracted and expanded, and it's not a very large muscle, but the way that it's being used, it gets mad. So in my last video, I did cupping around the pec and then the anterior and posterior deltoid, as well as on the back of the levator scap into the top of the trapezius muscle, and it actually feels really good afterwards. I do have some markings from it, so if you saw that video and then now you jumped into this one, some of the markings, not overly exciting. I've been cupping for a little bit, so they've been gradually getting better. On somebody that I'm doing cupping for the first time, especially if you're doing a lot of lifting, a lot of just any kind of abuse to the body, you're gonna get a lot darker of colors. But I've been slowly working on mine. Although on my left side that I did earlier today, that has actually a pretty significant cup kiss around it. The cup kiss is just what we call the markings. But yeah, those will fade in a day or two. So not a big deal. As long as you don't have any event coming up that you need to, take pictures for. It's just, people actually like having them. They like showing them off. They think it's fun. It's a conversation starter. And I know a lot of my athletes actually really enjoy kind of, bragging about them. I had one runner that I cupped the heck out of her legs right before a race, and she said she felt like a professional athlete. People were like, "Oh, you got cupping," and it made her feel special and cool, and it was helpful, and she loves it, and she likes getting cupped every time now. But anyways, so let's go back to the forearm, because that's what this video is about. So the pronator teres is not a very large muscle. So again, it stems off of the bony landmark right here, and then it comes to about right here. Actually, if you make a fist and flex your forearm, you can feel your pronator flare up. If you can't find it the other way, just make a little fist and bring your arm up, and you'll find it that way. So what we need to do is, I like for personal use, the sports massage oil. It is specifically made for cupping. It's a 8-ounce bottle, and it is a little pricey for how much you get, but like I said in the other video, I've been using this one bottle for over a year, and I'm just now past the halfway point on it. So So I mean, a little goes a long way, but it has a lot of healing properties in it that is what drew me to this product, and so this is what I use. Now, if I'm doing cupping on my clients, if I'm doing a full body session, you know, and they're paying, you know, the extra for that session, I'll use this oil. But if I'm only using the cups on a couple spots, I just use my regular oil, or it really can glide over cream too. But if you're going to be doing more gliding strokes versus just stationary positioning, you want to use oil and not cream if you're going to do some elongating gliding strokes, which I'm later going to do a full body video of cupping. I just need to find a body to work on, which usually isn't hard to find somebody who wants to receive a free massage. So that will be coming soon, so subscribe and stay tuned. Anyways, okay, so a little bit of oil. I mean, seriously, a little. Like a dime's worth. So you want to put a little oil on the skin. You know, just kind of massage it in a little bit. Just to kind of warm the area up. And then there's multiple sizes of cups that come in this kit. And the kit I got off Amazon, it was $20. Pretty sure it was $20. It's been a minute. But anyways, this is your large size cup, your medium size cup, second medium, next size down, I don't know. And then you got, oh, nope, never mind, just kidding. And then you got your itty bitties. In the pack I got came with 6 pieces for $20. Since I do this professionally, after I bought the first one and loved them, I ended up buying 2 more, so I have enough to do a full body treatment. So, but if you're doing this for personal use, 1 pack of 6 ought to do it for you. So again, Amazon, pretty sure it's $20, not 100% on that. After this video, I'm going to try and find the link for you, and I'll put that in the description below so you can check it out. Anyways, okay, so for this area, you don't want to use the big cup, so you want to use your second medium. I don't really know what to call that size. So you take your cup, and then you want to put 2 fingers on the top of the cup so you can push it in. Now, for some people, they may not like these because you kind of have to push hard, and if you don't have strong fingers, it might be uncomfortable for you. I don't have a problem with it. That's why I use the silicone over the plastic cups, and I definitely don't use the glass bulbs because the glass ones require that's more of a traditional use, and you actually use a little fire to create the negative pressure. And that's out of my scope of practice, and I don't think my landlord would like me playing with fire in his building. So anyways, tangent, sorry, I said I wasn't going to do that, but I did. Alright, so to place it on there, fingers on top, your thumb underneath, put it on the spot, and put your thumb underneath, 2 fingers on top, and then push in, and then it's on there. Now, if you're doing this to yourself, first, you know, get it right on the belly of the muscle and let it just sit there, and I just say let it cook. You may start to feel some tingling, like good tingling, not your foot's going to sleep tingling. And then you might start to feel some warm sensation. Totally normal. You want those things, so just let it happen. So we're leaving it on here for a little bit. You don't want your arm extended all the way out because you want your pronator to be relaxed. So if you're sitting on your couch, just rest your arm on the armrest or sofa, you know, chair, whatever. Just let your arm rest so that the muscle can be in its relaxed position. So let it just hang out there for a little bit. And then after a few minutes, you can actually start to take it and kind of, it's hard to do. That's not that hard to do, otherwise I wouldn't make a video about it. You just want to lift it a little bit, and then you can like slowly glide it up and down your forearm. Now if you want, I only put oil right where the pronator teres is, but if you want to get the full forearms, so say you're an IT person and you are doing this all day long, you know, all of your forearms are going to need some love. So you could have taken some of that oil and gone all the way up and down the forearm, and that way you can do nice long strokes back and forth to really help elongate those muscles. I did not, so what I'm doing, since I'm not doing elongating strokes, I'm just moving the cup, a quarter turn, just kind of moving it slowly around. Now, being that the pronator teres is not that big of a muscle, and it's not it is a superficial muscle, you know, it's closest to the top. You don't want to leave it on there for too long, because you can overstimulate the area and you can cause more harm than good. So you just want to leave it on just for a few minutes. So you're going to see not too much coloring with that, not too much going on. So you're thinking, you're probably thinking, you're like, well, that doesn't seem like it's going to really do much of anything. But actually, you would be surprised. So say you do a full cupping. Actually, I'm just going to do it. A full cupping of the forearm. Just warming up the area. You always want to get the muscles hot before you start going. And I'm actually going to go the next size up. That little one wasn't working for me so swell. Again, 2 fingers on the back, thumb underneath. Place it right on the belly. Yeah, now we got some. Actually, I'm on the struggle bus with this, so we're gonna go back to the next size down. I promise I'm a professional. I get paid to do this. All right, my forearms aren't really cooperating with what I was trying to do. And okay, so I'm trying to do a gliding stroke and the cup's not letting me. And the reason for that is since I do massage all day long, my forearms are junk, and it's hard to do a gliding stroke over areas that are really full of adhesions and knots, which is what I have going on. So that's why it's popping off. So in that case, if I was working on a client, or how I am for myself, I would just leave it in place and then just continue to do those quarter turns, and you can go out to the side and then up and then back, to the belly of the muscle. And then when you're done with it, to remove it, stick your thumb underneath it, and then you just pull it right off. So the benefits to doing cupping on your forearms can help dramatically with if you're having any carpal tunnel type syndromes. You can also cup in the forearm a little bit. You just don't want to go right here because you have a lot of superficial nerves and arteries. You don't have an artery there. Just kidding. But you have your nerves here, and so you don't want to cup directly over that. But you can cup on the meaty part of your forearms. But the most of your work that you want to be doing will be to the front of your forearm, because that's where you'll find the majority of your trigger points. So, and again, the big one is it's going to help with the pronator teres, but also if you can be more successful than I was, you can get all of your flexors. Your flexors are what's on the front of your arm, and your extensors are the back. and that can help with pronator teres issue. It can help with carpal tunnel type syndrome symptoms, and yeah, it can bring you some relief after a long day of just typing away at the computer. So I hope this video was helpful. I kind of went off the topic a little bit. I apologize. And if you're still watching and you found this video helpful, will you please tell me so? And if you think of any ways and how I can improve my videos, please leave that in the description below as well. I'm still very new to this, and I thrive on constructive criticism. So, and I really would like to try and make this a thing. So I would really appreciate if you could leave me a comment and tell me what you thought. All right, thank you. Have a good one.